All right, getting started. I'm on 285. Talking about the bones themselves of the pelvis and the thigh. The first bone that we run into are these two elephant ear looking bones. These are called the ilium, all right, on either side. The next bone that, well, it's actually a part of the entire pelvis on this side, but we have a bone down here. That's the bone that you sit on. So if you sit on a wooden bench for too long, your butt starts to hurt. That's called the ischium. And then the front part here, this is called the pubis. This is the most anterior bone of the entire complex. So this entire side is known as the hip. This entire side here. And this entire side is known as the hip on this side. This whole thing combined is known as the pelvis. Makes sense? Inside here, the dimples, this is known as the ilium fossa. Up top here, this is the iliac crest. You can palpate that on yourself. It's a moon shape. You can find the ridges of the crest. Two little bumps right here, right about where your pants line up. Your waistline, you're going to feel two bumps, and even if you move your legs, you're going to feel those bumps shifting. That's known as the ASIS, the anterior iliac, or anterior superior iliac spine, ASIS. And about, I would say 2 fingers width away, below that, posterior to that ASIS, is the AIIS. The anterior inferior iliac spine. So we have the iliac crest, which you can palpate, the ASIS, anterior superior iliac spine, the AIIS, anterior inferior iliac spine, which is located right there. Next aspect is the pubic bone itself. Easiest way to palpate that is obviously you don't want to come up this direction. You want to start from the umbilicus, work your way down until you palpate the pubis symphysis, which is located right down here. On the lateral aspect of the hip, you have the greater trochanter on either side. To palpate that, if we flip this over, flex the knee, internally and externally rotate, if everyone does this, you can actually feel the greater trochanter on your palm. If you place the palm right on the outside part of your hip, you can feel it passing underneath your palm. We flip over to the posterior aspect. We have this bone here. This is called the what? Sacrum. If you follow the iliac spine down to the posterior aspect, everybody know those two little dimples on the back here? Located within those dimples is the PSIS, so posterior superior iliac spine. So you have the ASIS, AIIS, and the PSIS. Posterior superior iliac spine. The sacrum and the ilium form a joint that's called the SI joint. It's the sacroiliac joint. You're not going to be responsible to be able to palpate that, but you need to know what two bones make up that joint. If we were to draw a line connecting the PSIS together, what vertebrae does that line up with? Review from a couple. L5, S1. Okay. L5, S1. You have your coccyx bone in the sacrococcygeal joint. You don't need to worry about knowing that joint. Just know where the coccyx is located. You can't really palpate the coccyx because the only way you can really palpate that is through the rectum. And that's a little too advanced for this class. And then back here, these are called your ischial tuberosities. So, following along in the book, on 285, we talked about the anterior superior iliac spine. We talked about the iliac crest. 286, we talked about the posterior superior iliac spine, PSIS. The pubic crest. 287, the ischial tuberosity and the greater trochanter. 288 is kind of a review of all that stuff. 290, the sacrum. We've talked about that. You should be able to palpate the sacrum. 291, like I said, the coccyx, just know where it's located. You don't need to worry about palpating it. And the sacroiliac joint, you don't need to palpate that either. 292, again, the greater trochanter. At the bottom of 292, the gluteal tuberosity. Don't worry about that. You can cross that out. You can cross out the umbilicus and the pubic tubercles. On 293, we talked about the pubic crest. 294 and 294, the superior ramus of the pubis. It's important to know this because when you get into origin and insertion of some muscles, you're going to need to know where these are located. You don't need to palpate it, but just so you know where it's located. This area right here, on either side, that's known as the superior ramus of the pubis. And then the inferior ramus, you can cross that out. You don't need to worry about that. On 295, the ischial tuberosity, again, we talked about. So that's it. That's all you really need to know for palpation. So to review quickly, we have the, what's this called? ASIS, which stands for what?
Anterior
Superior iliac spine. You have these bones, these little bumps down here, which are AIIS, stands for inferior iliac spine. We have the pubic crest, located right here. You have the superior ramus of the pubis, located here. You have the greater trochanter on either side. You have the head of the femur, neck of the femur. These big ear-looking things are called the ilium. This big bone here is called the sacrum. This joint is called the what?
Don't whisper into my camera.
Sacroiliac, like the sacroiliac joint.
Correct. The SI joint, the sacroiliac joint. This little bone down here is called the coccyx. These bones are called the what?
The ones you sit on.
The ones you sit on, known as the ischium tuberosity. These bumps back here. PSIS, which stands for what?
Posterior, superior, iliac
Spine. Very good. And
Good
this
job.
up here is top part of the elephant here.
iliac crest.
Iliac crest. Very good. Let me think. I think that's everything. Yep. Any questions with those?